Hi YouTube, Luminous Star here. Welcome to my channel, Luminous Star. If this is your first time visiting, welcome to the Luminous Star channel. Guys who are my current subscribers, thank you so much for your subscription. Guys, today I'm going to be talking about the getting clear on the layers of trauma. This is what this video is about. So at the end of the video, please leave me comments and or questions, and also hit the like and or subscription button. During this video, I'm going to be sharing with you guys 3 points, and also maybe I'll give about 1 to 3 examples. Possibly. I'll think about it as I go along. Okay, but I will be sharing with you guys 3 points in this video. Again, the video is about getting clear on what the layers of trauma is, right? Because a lot of us who especially have been diagnosed with PTSD and may also be dealing with complex PTSD, we're not always clear on what the traumas are or the origin of the trauma. In other words, what caused the trauma in the first place. We're not always quite clear about that. Sometimes we have suppressed some memories, which is understandable because certain experiences in life to a child is so painful that they have to suppress those memories just to survive, right? And hopefully, I want to go ahead and put this out first before I even get started really and get deep into the video. I hope whoever you are, if you are dealing with symptoms of PTSD and complex PTSD, right? I hope you have a support base. I hope you are getting support, because this is not something to deal with alone. And I'm speaking from experience. I was diagnosed a few years ago, right? I was diagnosed with PTSD. However, I have some memories in my childhood, whereas I know for certain that there was a narcissist that had something to do with the programming to my subconscious mind when I was a child that absolutely caused me trauma. So this is something that I'm speaking of from experience, right? And I do have a support base, which has been very helpful. So this is something I wish for every last one of you who are, who are visiting this channel, viewing some of the videos. I hope you're looking at plenty of the videos, okay? And hopefully they are inspirational to you as well as motivative. Okay, and along with your journey that you are healing. I hope that things that are being said in this video, some of the information that I'm giving and sharing, actually really just sharing, because I'm doing some things in my life too, such as keeping my support base pretty strong. Okay, so I hope that these videos on Luminous channel, Luminous Star channel, is absolutely helping you to continue to get your healing. Okay, so I know I'm babbling on now. Okay, plug it up. I'm going to go ahead and jump right into the video. Again, I'm going to be giving 3 points and possibly 3 examples with those 3 points. Should you need clarity at the end of the video, please send me comments and or questions pertaining to those points and examples should you need clarity. I'll get back with you from about 1 to 3 days, okay? So please be patient with me. Okay, guys, here we go. First point. You may have to get clear on the layers of trauma in order. Matter of fact, let me put it this way. Here's the first point. You may have to rearrange the chronology of the layers of trauma. What order are they in? Because right now, you may not be quite clear on what the layers of trauma is, and you may not be clear on the origin of the layer of trauma. The origin of the trauma. You may not be clear on that. So the chronology of those layers of trauma may be all out of order. So you may have to, ma'am, sir, right? You may have to get clear on what the origin of the traumas are. Then as you look at the layers, right, you can start or begin to put them in order. This, guys, is what's helped me to figure out what my support base will consist of. What and who. Okay, I'll make that in another point. I'm talking about the support base. That's another point I'm going to make. But let me stick with the first one. Getting clear on the layers of trauma as well as the origin of the traumas. Right? Get clear on it. You have to go ahead and rearrange, more likely, the chronology of the layers as well as the trauma. Sounds like a tall order. Guys, I'm going to share with you that helped me a lot. Here's the example to the first point that I just made. Rearranging the chronology. Right? Here's the example to that. It's like sometimes I went to receive treatment and I didn't need the treatment for the trauma or the layer of trauma. Right? I didn't need it. That was just like me taking a pill for a backache, but I had a headache. Right? And I didn't know which doctor to go to help me with that. I didn't know where to go to help me with that because I wasn't clear on the treatment that would help me with the ailment. I wasn't clear about much of anything. All I knew was that I was going through something. Wasn't feeling too good, right? Nightmares, flashbacks, becoming irritable for seemingly no good reason. Depression, anxiety, the list goes on, right? All I knew was that something was going on with me, right? Wasn't clear on exactly what, so therefore I couldn't be clear on what treatment would be effective. And I wasn't clear on who would be able to assist me with that. I wasn't clear on who I should or could team up with to help me in my support base, which is my second step. Second example and second step. Second point, right? Which is the support base. So I hope the first point and example was clear to you guys, right? Second point, support base. You have to get a support base for yourself. And I'm not judging and I'm not telling you what to do. I'm only suggesting because this is what helped me out. What I'm sharing with you guys is what I've already gone through, right? Okay, support base. When I made the decision that I was going to get a support base for myself, yeah, it was a game changer. Absolutely. Because as I became clear, right? As I became clear on what the layers of trauma was for me, not for anybody else, for me. Because I got clear on what the traumas were and I got clear on how they came about. That's the first point. So I started to rearrange the chronology of those layers of trauma. And really, nobody else could do it. Nobody else could do that. I had to get clear on what was up with me. Right? Second point, again, the support base. Very, very, very important. You cannot do this alone, guys. I couldn't do it alone. I tried. That turned out to be a disaster. Because actually, that can re-traumatize an individual. And it can cause another layer of trauma to occur if you try to do this alone. If you try to deal with the trauma alone, if you try to deal with the fact that you've been traumatized alone, yeah, that can cause another layer of trauma. And it can cause you to be re-traumatized. It can cause a person to be re-traumatized. So the support base is very important, right? Because this, once I found out, guys, how effective the support base was for me, I stuck with it. And this is a support base, again, whereas I team up with other people who can absolutely help me in my healing. They can help me take the steps. I can learn from them. And they learn something from me because I'm telling them and sharing with them what the symptoms are, what I'm going through. So I'm teaming up with people that consist of my support base. Makes it very strong. Yeah. So if you're trying to, you're out there, you're trying to go it alone, it's not helpful. So in this video, I really hope to inspire and motivate you to at least consider a support base for yourself, because this is something that you headquarter, you run, because you get to say, right? You're the captain of that ship. Absolutely. So I shifted my perspective and I shifted my view on that. Instead of looking at it like, oh my goodness, I'm at the mercy of other people helping me. No, I'm not at the mercy of other people helping me. I'm the one that's going through this. I'm the one that's been traumatized. I'm the one who goes through, every day, the symptoms, dealing with it. So I acknowledge that. Right? So when you go and you team up with other people, you get to, it's almost like you're that person who gets to interview on the job interview. You're not the interviewee, you're the interviewer. You get to see, right? You get to speak and interact with people who supposedly are experts, healthcare professionals that can help you, clergymen, counselors, somebody, maybe you have a mentor from your past and you guys are pretty cool. You have a mentor. Mentors are effective. See, this is going on to my third point, but let me stick with the second one. Let me finish the second one up, which is the support base, how important it is. So I know for me, guys, yeah, it was a game changer. Because once I got clear on the layers of trauma and the origins of the trauma, that was tough, by the way. Man, that was a ride and then some. I felt like I was being initiated within the initiation. Okay? Yeah, I'm not going to even get into that right now. It was not easy just to get clear and to rearrange the chronology. That was a hell of a feat, right? But I had to do it. Then I started to get clear on, okay, I need a support base. I can't do this alone. Not because I'm a loser, no. The support base is very effective because I saw the support base as a great tool in my healing process. It was an awesome tool, the support base, and I'm running it. You know why? Because I get to interact with people who can help me. I get to say who I get to choose who I'm going to team up with. That's how I look at it, as teaming up. So instead of looking at myself as a victim and as small, right, voiceless, no, I have some say. I do count. I do contribute. I do have some say in my life. I'm responsible for my life. Nobody else can save me. I save myself, right? So that's how I began to, that's why I say I shifted my view. So I said, you know what? I get to talk to clergymen. When I made the choice, I'm going to talk to clergymen or whoever I wanted to talk to or speak with about this, right? You have all the say in that. You get to choose. So you're coming from a place of power, personal power. You're not a victim. And I'm not belittling what happened to you, right? So I shifted my gears instead of saying I'm a victim. When I was a child, I was a victim because I was subjected to narcissistic injury. I was subjected. So that's when I was a victim. Only time in my life I've ever been a victim, right? So shifting the perspective, shifting the gears on the view. Build a support base for yourself. Very effective. And you are the captain of that ship. You're not forced to open up and talk to somebody about this. You're not forced to. You can choose to from a place of personal power and saying, you know what? Trauma is not going to whoop my ass. I'm going to put trauma in its place. Trauma is not going to whoop my ass. This is my life, not trauma's. Okay, so shift that perspective a little bit. Be that person that's gonna, start that process of your support base. And as time goes on, you get stronger and stronger, and so does your support base. You don't have to trust me, try it for yourself. Third and final point. When you get clear on the traumas, right? You get clear on it. Once you get clear on that, and you rearrange the chronology of the traumas, then you get your support base set up. You start that. Take baby steps. Pace yourself, right? This is not a contest. This is not a race, right? You're worth it. I hope you see that. You're worth that, right? So once you do that, my third and final step is this. When you get clear on that, then you can start to see things a little bit more differently, because automatically it's going to happen. Things are going to start to they're going to start clearing up. Yes, the ride is not going to be easy. It's going to be tough. There's going to be some detours. There's going to be some land slopes and landslides. There's going to be quick jolts and turns and bumpy roads. Yes, it's going to happen. I'm not going to even sit up here and give you some BS about, oh, you just do these steps and voila. No. I've already put in some work, some personal work. So this is why I'm able to speak about it a little bit more candidly. Because at first I didn't talk about it. There was some destructive behaviors on my part. My coping skills wasn't up to par. That's another video. But now I'm able to, I'm at a better place now where I can share this with you guys. Okay? So again, the third and final step is after you get clear on everything, keep moving. See that you're worth that. Keep taking the steps, because it's going to get tough. Sometimes you will feel like giving up. Yeah, because the traumas, all the narcissistic injuries, all the toxic relationships where as maybe you were abused, or maybe you did some of the abusing, okay? I can raise my hand to that one. So, anyway, when you get clear, keep going. That's my third and final step. Keep going no matter how rough it gets, because it's going to be challenging. Some points are going to be more challenging than others. Okay, so I hope that helps, right? And I want to leave you guys by saying this. For those of us who had narcissistic parents, right? When I'm speaking of those layers of traumas, and by the way, I would like to suggest viewing my video about layers of trauma, and also complex PTSD. Complex PTSD versus PTSD, part 1 and 2. Please view those videos. I suggest those videos, to you, because it can go along with this one. And this is what I want to say, and I'm going to finish the video. Some of us who, as children, had narcissistic parents, right? There was narcissistic injury that was repeated throughout the years. So imagine at the age of 1, you have a narcissistic parent. They're going to start downloading some crappy programming into your subconscious mind, right? That's going to take a negative effect, a negative and profound effect upon that child. I'm speaking from experience. So that means layer of trauma. That may be the first layer. However, what I really want you guys to get is that throughout the years, all that narcissistic injury from the parent, you go on to 1 year, 2 years, 3 years, 15 years, 18 years, right? Now you're an adult. But look at 18 years of narcissistic injury, abusive behavior, at the hands of a narcissistic parent. That's going to be plenty of layers of trauma. They're going to interwove. But that's plenty of layers. You got more than one layer. That's more than one layer. That's where complex PTSD comes in. Because it's layers of trauma. The child has layers of trauma due to narcissistic injury at the hands of a narcissistic parent. That's pretty much where complex PTSD comes in. The PTSD happens first, then the complex PTSD. Is never the other way around. Never. Also, if you are in a toxic relationship, if you are an adult, you're in a toxic relationship with another adult who may be a narcissist, you cannot develop complex PTSD from that. Never. Can't happen. Impossible. Never will happen. Never has. This is only pertaining to people who have had narcissistic injury from their narcissistic parents as children. That's where complex PTSD comes in. So it has to start when you're a child. It does not start and develop as an adult. Doesn't happen ever. May I suggest also to research complex PTSD. Okay, guys, I hope you enjoyed this video. I hope it was very informative. And I was not trying to, babble on too much or make the video very long, but hopefully it was very effective to whereas you are motivated and also inspired. And you'll come back and see me. Okay, guys, take care of yourself. Remember, you are worthy of a great life. All right, take care. Till next time, stay tuned for more videos. Mwah.